Boris Johnson, the Prime Minister of the United Kingdom, has been transferred to intensive care after his coronavirus symptoms worsened. The 55-year-old was admitted to a hospital in London on Sunday evening local time after suffering persistent symptoms of the virus for around a week and a half. Che Won-jong reports.
British Prime Minister Boris Johnson has been moved to intensive care unit in London after his COVID-19 symptoms took a turn for the worse. Downing Street announced late Monday local time that Johnson remains conscious but was moved to the ICU as a precautionary measure after he was admitted to St. Thomas Hospital the previous day. Foreign Secretary Dominic Raab has been asked to deputize for him where needed.
During the course of this afternoon, the Prime Minister's condition worsened, and on the advice of the medical team, he was moved in to a critical care unit.
Elsewhere in Europe, Spain now has more confirmed cases than Italy and Germany, but Italy still has the highest death toll of more than 16,000 as of late Monday local time. Germany has surpassed 100,000 cases but has a lower death rate than many other countries in Europe. A number of European nations are continuing to impose national lockdowns, and non-essential stores remain shut due to safety concerns. As the world's new COVID-19 epicenter, the United States is approaching 370,000 confirmed cases, while the death toll has surged past 10,000. An official at the U.S. Department of Health and Human Services says this week is going to be the peak week of new infections and deaths in New York, New Jersey, and Detroit. Meanwhile, in his daily COVID-19 task force briefing at the White House on Monday, U.S. President Donald Trump said the United States was saddened to hear about British Prime Minister Boris Johnson's worsening health, adding the American people are praying for his swift recovery. Che Won-jong, Arirang News.